It's a Northwest lifestyle weekend on Como News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
All right, our next guest is Dr. Julia Becke, internal medicine physician from Pacific Medical Center First Hill, talking about the keto diet. You've got the keto diet, Mediterranean diet. You've got
paleo,
the paleo, the seafood diet. If you see food, you eat it.
Yeah, that's me. That's my diet.
But we're going to talk about that keto diet today, and I'm interested to learn a lot more about this because I've heard about it. So let's get to Dr. Julia Becke and Shannon O'Kelly.
Dr. Beck, welcome back. Thanks for joining us again on Health Talk. I think it's been about a year you came on the last time we talked about bug bites, right?
Correct, yes.
All right, we're doing a 360 here. We're going to talk about us eating today, not being ate. We're going to eat something here, but we're going to talk about the keto diet. Really hot in the media. You hear about it all over. What is the keto diet? Let's set it up and how that kind of works in your practice maybe.
Yeah, absolutely. So, in my practice at Pacific Medical Centers, people often are asking me about the keto diet. Essentially, it's a style of eating that limits carbohydrates or starches. Sometimes people think of those foods as starches.
So it's a starch-free diet. You're basically going after vegetables and protein, eliminating the starch, and that's called keto because if you eliminate the starch, you force your body into something called
ketosis.
Yeah, let's talk about that. That's the old Krebs cycle, isn't it?
Exactly, except it's the reverse Krebs cycle.
There we go.
Yeah, so instead of, kind of metabolizing the sugars that we take from our food, instead the idea with ketosis is that you're breaking down the fat that's stored in your body into ketones. So the theory is that you can use ketones, and in fact, our body can use them for energy, but there's some shortcomings to using this style of eating.
Well, let's just talk about some physiology and how our body works. Maybe we can set this up. This is a 2-day program. We're going to do it in a couple minutes here, and I know you can do it.
Yeah.
But so your body is essentially all the time taking food supply in and saying, what do we need to do with this? And you're going to use it if you're exercising and burning calories, you use it. But if you're not burning enough calories, your body says, oh, let's store this for a rainy day, i.e. fat deposits, right?
Mm-hmm, correct.
So in a keto diet situation, what you're doing is you're eliminating starches, so your body's going right after those fat deposits, constituting fat into ketones that becomes basically sugars.
A type of energy.
Right?
Exactly.
But the problem is there's some diseases that you have ketosis in. I think diabetes is one of them. And is it good to be in ketosis all the time for your body? I know this might be a little controversial, but as a physician, let's talk to your patients right now. And what would you say?
Yeah. So, what I tell my patients is essentially when you're in ketosis, you're in starvation mode. And when we go into starvation mode, our body starts to, use this energy sort of in an emergency fashion. And if you can imagine kind of being in a state of emergency all the time, that's not necessarily a great position for us to be living in.
Your body basically goes in, you're forcing your body to essentially go into kind of a survival mode.
Exactly.
Because, you're starving yourself or starving your body of those simple sugars.
The simple sugars that your body needs and typically will acquire through eating healthful carbohydrates like grains and fruits and some vegetables.
And how do you feel about this diet? Because it is really a craze out there. I don't want to put you on the spot or anything like that, but how would you talk to your patients about the keto diet?
Well, I have pretty strong feelings about it. I often will tell people that, we can think about how we eat and trying to lose weight in the form of a quick gain or a quick loss, I guess theoretically, in the form of using sort of a fad diet where you're eliminating a food group and, maybe dropping weight really fast. Or we can think about how you eat as a lifetime goal. And are we eating for health and are we eating for longevity? And I'm not sure that the ketogenic diet is a way to eat for health or longevity.
Do you know offhand where it started? Because even today's world, you can go into restaurants and they have keto menus. It's all over out there. And it just kind of snuck up on us. I don't remember it.
Yeah. Well, thinking back, we remember the Atkins craze of the late 90s. And if we take it back further, the ketogenic diet started, more than a century ago, but as a medical diet and used in very particular medical situations. There's still some times where that can be useful for a very particular group of people, but medically guided. the care of a nutritionist type situation.
That's Dr. Julia Becke. Had you spent much time learning about the keto diet at all? Did you know much about it before we
Yeah,
talked
it's all over. You can find it everywhere.
Yeah,
so
the covers of a lot of magazines are talking about it. We're going to talk a little bit more about it, too, right after this time out on Como.
It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
All right, we continue our conversation now with Dr. Julia Becke and Shannon O'Kelly talking about the keto diet here on Como.
Well, Dr. Beck, again, thank you for joining us again on Health Talk. You're wonderful, and you're doing a great job talking about the keto diet. As we're talking, I can't help but think there's got to be someone has looked at some kind of studies, because when you mention like you're in survival mode, I mean, your body basically functions, we call it parasympathetic or sympathetic. I mean, it's what we call fight or flight, right? And if you're in that fight mode all the time, I couldn't imagine that would be good. I'm talking about the cardiac system. I'm talking about the fat content, the amount of protein. Got to be a balance somewhere.
Absolutely. Researchers have been really trying to understand, risks and benefits of this style of eating. And there was a study out of China earlier this year that was presented at the American College of Cardiology that followed a big group of people, over 10,000 people over the course of a couple decades. And granted, it was an observation study. They didn't divide them into groups necessarily to see what happened, keto versus not keto. But they asked them, how are you eating? What kind of foods do you eat? And then followed them in terms of their health issues. And it turned out that people who followed a very low carbohydrate style of eating had an increased risk of a particular type of heart rhythm disorder.
Interesting. Is that, do they think it's probably because of the change in the nutrients and nutrition that's in the bloodstream? Because I don't know, that it's got to be something there, right?
Exactly. Yeah, they're sort of hypothesizing right now, but their guess is, well, is it related to oxidative stress? Is it the stress from these high-fat foods and the types of metabolites they produce? Is it the stress of eating just very high-fat foods in general and how that predisposes us to all kinds of cardiovascular risk?
I'm going to have to ask here, what is your recommendation in your experience when a patient comes to you and says, hey, I'd like to lose 25 pounds? And I mean, we all know balanced eating, nutrition, et cetera, but do you have a particular diet out there that you like? I mean, there's the Mediterranean, there's paleo, there's all kinds of stuff out there.
Absolutely. Well, it does come back to, let's look at the data and let's see what helps people live long, healthy lives. And what we see is that when people limit animal fats and instead they focus on more plants, a little bit less meat, trying to get those whole grains, lots of fiber, that style of eating does help to promote less heart disease, less cancer. That's my goal, prevention. I want you to stay well.
That's good to hear. Have you ever, by chance, read the book, The Blue Zone? I think it's called The Blue Zone. Have you ever read that?
No, I haven't.
The Blue Zone is an interesting book if you ever get a chance to read it. And what this guy did, he traveled the world and he came across these communities where these people were living to be 100. I mean, there were a lot of people living 100. And what is the common theme? And that's what it was. It was a healthy diet, which is plant-based, less red meat, more fish, things like that. I mean, if it's got a bright color on a vegetable, it's probably good to eat.
It's going to be good for you, absolutely. And if we look at our long-lived patients, there's always going to be exceptions, but generally it's people who've eaten a variety of foods through their lives and been careful about the choices they make. And
I think what I've found, just talking to people, if someone loses a lot of weight really fast on a type of diet, a lot of times they're not changing behavior, so it comes back a year later, right?
It's going to come right back, and we don't see any difference if we look at like Atkins diet or paleo or high carb. People get to the same place eventually.
Well, Dr. Beck, again, thank you for joining us again, and thank you for the information.
Absolutely.
That's been Dr. Julia Becke, internal medicine physician for Pacific Medical Centers First Hill. You can get more information, pacificmedicalcenters.org. Keto diet, Mediterranean, we talked a little bit about this at the beginning. Is there one that you've heard that maybe is better than others?
Boy, Tom, they're all different. And I mean, I've heard a lot of different options out there. I mean, talk to your doctor about the diet you're going to pick.
Good plan. All right, we're going to talk to Dr. Otano Silva after this time out on Como.